and we should have launched that. Thank you all for coming. Tonight is the Nicotine Awareness Town and Help Town Hall. My name is Rocco. I use any pronouns, and I'll be one of the panelists for today's town hall. We'll get into introductions in a second, but again, I just want to give a heads up. This meeting will be recorded and will be uploaded to the Columbia Health website. We will not be sharing the slides for this presentation, but you are welcome to take notes if you want throughout. We also have a Q&A function that folks will be able to answer and submit any questions to if they do have any questions for us as the panelists, and there will be questions, time for questions at the end. Um, as a quick overview for today's town hall, we're going to go into introductions in a second. But the Nicotine Awareness and Help Project is done in partnership with the Truth Initiative. So we'll talk a little bit about what that's like, the grant that we received from them, and what are the expectations for the grant. We'll do an overview of the Nicotine Awareness and Help campaign, what we've done so far, what's the feedback we've gotten from the campus community around this project, as well as the current and possible policy related to smoking. I hope if you have come, you are aware that we are analyzing the smoking policy on campus. Part of this is a question of whether or not Columbia University should become smoke and vape free. For context, Barnard College and CUIMC have already become smoke and vape free, as has Teachers College. So this conversation is more about, do we want to be in alignment with those campuses, and really getting feedback from the campus community about what their thoughts are on what the policy should be. So we'll talk a little bit about what's the feedback we've been getting, as well as the plan and the timeline for submitting the policy proposal. And then we'll have times for questions and comments at the end. So I'm going to give some space for folks to introduce themselves. I'll start, and then I'll pass it to Alec, and then Arthur and Jackie. So my name is Rocco. I use they/any pronouns, and I'm a health promotion specialist with Alice. So I oversee all the substance use recovery initiatives, and I am a project lead or co-lead for the Nicotine Awareness and Help Project. I also oversee our nicotine cessation program. I'm a tobacco treatment specialist, and I'm a certified professional with the American Heart Association for tobacco treatment. So I'm often helping students navigating the quit process, including navigating quit smoking medication, their relationship with nicotine, etc., as well as helping students quit. And recently, as you'll come to find out, I launched a group nicotine cessation process as a part of this initiative as well. So the TLDR to know is that I'm one of the leads for this project, and anything substance use related, especially nicotine cessation, comes through me. And then I'm going to pass it to Alec, who will introduce themselves, and then we'll have Arthur introduce themselves.
Hello, welcome. My name is Alec Chakowski. I am the Senior Executive Director for Alice Health Promotion. I use they, them pronouns, but I will also respond to any used with respect. I will also go ahead and introduce Jackie. She is our Director of Direct Services for Alice Health Promotion, and she is in the background tonight providing us tech support and chat support. And I will pass on over to Arthur.
Hey all, my name is Arthur Campos. I use he, him pronouns. I am one of the project leads for the project that we're going to be talking about today for NA here at Columbia in partnership with the Truth Initiative. I work underneath everyone else here, but I report directly to Rocco and alongside another a graduate student. I'm an undergraduate student at the School of Engineering and Applied Sciences. Alongside another graduate student, we work on initiatives to understand the student body's current view on the policy around smoking on campus and the usage of nicotine-based products, and how we can tailor it to best fit the needs of the student body and following the Truth Initiative's guidelines.
Thank you all for introducing yourselves. We're really excited. Arthur and he mentioned a graduate student, her name is Taylor, are the two project coordinators that work alongside us. And if you know anything about our office, we're the Alice Health Promotion Office, and we do a lot of peer-to-peer work. So it was really important for us to have a graduate student and an undergraduate student represented in this project, so we could get a fuller scope of what students' thoughts were between undergraduate, graduate communities and things like that. So we're really excited to have Arthur with us, and Arthur and I will go through kind of the feedback we've been getting and the outreach initiatives we've been doing. But we really try to have student involvement in anything related to this policy, especially because students are the ones that might be impacted the most by this policy change. I'm going to volley it to Alec, who's going to give us some background about the Truth Initiative.
Thank you. So, to give you a little bit background of the Truth Initiative, this is a grant that we received in fall of 2013 now, or 2013, wow, 2023. I just went back a long time. And then really started it in spring of 2024. And the grant is to really look at the current policies that we have on campus and to assess them. We get feedback from students, faculty, and staff with the intent of revamping the current policy and then to look at whether or not it is feasible for us to move toward becoming a smoke and vape free campus. And Columbia University is one of 10 colleges and universities that received the grant within this grant cycle. Next slide, please. So really the context of this is really to look at the impacts of nicotine and related items. So this is both smoking and vaping on folks in campus. So this is thinking about things like when you're coming in and out of buildings. That's one of the things Arthur and Rocco are going to talk a little bit about that we hear quite a bit about is those areas around the buildings, the areas around the library, within the buildings, because even though it is against policy to smoke and vape inside, it is happening. Um, we know that there's a ton of research on the exposure to secondhand smoke, and we are starting to get more research around secondhand vapes. Understanding the real social norms and understanding the data regarding nicotine use. For a really long time, nicotine use was actually going down, but with the introduction of vapes, we have seen a steady increase again in people using nicotine products, and really also looking at the motivations for why people are choosing to use nicotine products so that we can offer alternative options. One of the things we hear a lot about is things like stress. So what are other things that we can do to allow for stress relief and stress management that do not involve using a nicotine product? Next slide. And then really thinking about why now. So the last time we as a university looked at our tobacco smoking nicotine policy was over 10 years ago. So this was before the rise of e-cigarettes and vapes. There has been some language added into the policy about those products, but there wasn't a revamp. It was just adding it in. We really want to look at that now so that it can speak more to those products. We also, in that period of time, other campuses have changed their policies, including the ones our affiliates that Rocco mentioned at the beginning that have become smoke, vape, nicotine free completely. So yeah, Barnard, Teachers College, CUIMC, the medical center, all of them now are smoke and vape free, and we are the one campus within our system that is currently not. We also really wanted to look at the knowledge of the current policy, and Rocco and Arthur will speak about this more, but people don't know a lot about our current policy. So there is a lot of education that we've been able to do through this process as well. So that's why now that we really have been focused on working on this. And I will volley it back to Rocco.
I will also add that one of the other factors that went into the reason we did this project is because since we work in the health center, we often meet with students who are navigating different concerns around health and wellness. And one of those concerns were students who might be exposed to secondhand smoke or frustrated that they're exposed to secondhand smoke, whether it's on campus or navigating academic buildings. One of the more recent things that we've been having, I've noticed, and a student mentioned, was outside one of the academic halls. It was Dodge Hall. If you look at the disability ramp, like there was a bunch of cigarette butts because it's where people will smoke. And what does it mean for somebody who might be physically disabled navigating that and like having to take their wheelchair over the cigarette butts and stuff like that. So there's different reasons and conversations that students have been telling us in the health center as indications as to why that they're interested. And to the point about increasing knowledge about current policies is also to help students understand, and truthfully staff and faculty too. Okay, if I'm on this campus, so I know it's smoke and vape free, because sometimes we'll have students who come from Barnard or come from CYMC or vice versa, who might be confused about what the policy is depending on where they're at. So it's meant to help students really be able to recognize, okay, all of these places are smoke and vape free. So it's kind of making it a little bit more streamlined and more readily available and accessible to students. So to the actual project that itself, so nicotine awareness and help or not is meant to be this conversation around the social norms of nicotine use on campus, as well as doing education campaigns, getting feedback around the policy, the both current and proposed, as well as offering like more of a community level approach around quitting nicotine. Not itself is meant to be kind of this colloquial term that folks will use when they are quitting. So it's meant to be kind of reinforcing the idea of if you're quitting and somebody offers you a cigarette or a vape or something like that, like getting used to the idea of refusal tactics, especially if you are trying to quit and stay quit. So it's meant to be kind of that social norms piece. Nicotine awareness and help itself is a subset of responsible community at Columbia, which is really encouraging safe, smart, responsible substance use. So part of that is flows into the other conversations we have about other substances, and you'll see how it maps on a little bit when we talk about the proposed policy and enforcement. Um, but some of these facets of this initiative include the actual nicotine cessation program. Like I mentioned, that's the one that I run, as well as Jackie and Alec are also both tobacco treatment specialists. So we have supported folks in the past who are quitting. And I did launch a group. It's called a super group. So it's substance use prevention, education, and recovery. And it's meant to be kind of these substance use spaces that folks can come together. I did a quit smoking group, and for the most part, it was really successful. It happened last semester, and we're hoping to have another one this semester. But it's a part of our group wellness coaching initiative. So it's meant to be students coming together and coming up with quit planning together, navigating being on quit smoking medications, et cetera. So it was a really successful group. The folks in it really enjoyed it, and they were able to enjoy the fact that they were able to talk to other students who were quitting as well, and be able to have folks with them on their journey that were going through very similar experiences at the time, because it made the process a little bit more easy. Because if you know anything about quitting, quitting is hard, but having folks to go through with it, especially that social support, can be really helpful and help alleviate even some of the feelings of the confusion or even the withdrawal symptoms that show up. Additionally, we also installed a vape disposal bin, which is the picture on the side of the screen here. We're very excited for this, and there's a lot more vapes in it now than what's in this picture. But it's meant to be a safe place that folks can dispose of their vapes. So if you know anything about vapes, it's got nicotine in it, it has lithium batteries. It's not safe for the environment to throw it out in the general trash. There's also a concern about fire hazards, especially in the waste management facilities, as well as just causing fires in general trash. So we wanted to offer a place for folks who do vape that can dispose of it safely, and it can be disposed of in a way that limits the environmental impacts of vapes. So this is a resource that folks are still learning about, but it's growing and we're really excited. It's kind of the pilot of it. So if it ends up being really popular, we might look at seeing if we should add other vape disposal bins across campus. But it's really a place for folks to get an understanding of, okay, this product is hazardous to the environment. Let me figure out ways to throw it out. And part of that, again, is around that safe, smart, responsible use. So if somebody is using vapes, we want to be able to throw it out in a way that isn't causing any more harm to the environment than what it could be. Additionally, we also updated our Go Ask Alice health site. Get into it. It is one of the oldest health Q&A sites on the internet. We added information about nicotine that's more up to date. So it's meant to be help folks who are quitting or even thinking about quitting, be able to get information about how do they start the process? What does it look like? What is the timeline for these things, which is often questions that folks will have when they're starting this process. So it's meant to be a health education resource for those folks. And then, of course, other education and awareness campaigns that have been doing. Part of that has involved a couple of different events and gathering feedback from the community, which we'll talk about in a little bit. One of the biggest pieces of feedback that we've gotten over the course of this year is that students want to see us actually in the communities themselves. So students are like, we want to see you in our schools talking about this and stuff like that. So that's something that we've been doing this semester. I've been reaching out to the variety of the different wellness deans across campus to really start tabling in the universities. 2 hours ago, I was sitting in the GSAS student lounge talking to students about the project and what their thoughts are about the smoking changes and stuff. Arthur and I were in GS last week. I went to School of the Arts. We're doing SPS next week. So there's a number of different schools we're getting feedback from, and it's been really successful so far. Students have been giving us their feedback. They've been giving us their thoughts about what they want to see the policy is. A lot of the times it's similar to what Alex said, where we're getting kind of these responses of like, okay, what is the smoking policy on campus? Because there might be some confusion around that. It's really about dispelling some of those myths and being able to help folks understand what the current policy is. And if you're wondering what the current policy is, it will be the next slide. We've also been doing environmental scans, which we'll have Arthur talk about in just a few minutes. But we've been doing kind of scans around campus just to see what the current policy is, or how the enforcement of the current policy is. For anyone who doesn't know, the current policy involves designated smoking areas around campus, and there's 14 of them, but they have changed over the last 10 years. So you might see a variety of different maps across the website. Some of the maps show, for instance, that outside Butler is a designated smoking area. Other maps do not show that and show that it's the first bench right outside the library. So it has changed and it has caused some confusion. The uh, the current policy, though, is that there are designated smoking areas, including vapes. Often those areas are not right outside the academic buildings, which is part of what started with this issue. And smoking is prohibited indoors as well within 20 feet of all university buildings. That includes undergraduate housing. And that's also a New York State law and a New York City law. So you can't be within a certain number of feet from buildings if you are smoking. Um, Enforcement of the policy is the responsibility of all the community members. So it is responsible. The responsibility does fall to the folks of Columbia as well as the folks in the specific schools. One of the pieces of feedback we've been getting from different like admins of the different schools is that sometimes they have to take signage into their own hands, for example. If you go to Dodge or Lewis and Hall, you'll see like specifically they've created their own no smoking signs because students were often smoking right outside the doors, which isn't a designated smoking area. So part of that has been good and bad because it means that it means that we're a little bit more self-enforcing and we're trying to not necessarily have a punitive approach. But on the other hand, it means that a lot of that enforcement falls to the administration where there's not really like a streamlinedness to it or kind of like a cohesiveness to it. So that's part of what this policy change has been to address as well, is how can folks talk about these policies and really help with enforcement and encouraging compliance with the policy. Because the main thing at the end of the day is if people are going to smoke or vape, we want them to be able to do so in a way that it's also not exposing other folks to secondhand smoke or vapor. So that's really kind of the if you needed like a TLDR of what we're doing. And also, the university prohibits employer retaliation against employees or applicants who exercise any rights under this policy. So, rights being they can't necessarily decline somebody a job if they are smokers or anything like that. So, that's really the current smoking policy. And this is only for Morningside Manhattanville campus. It's not for Barnard, TC, or CUMC. They all have different policies. The proposed policy changes that we are looking to make involves Columbia becoming smoke and vape free. We are taking feedback if Columbia should become nicotine free. Nicotine free doesn't just include smoke and vapor products; it also includes things like nicotine pouches. There is a policy at TC. TC is the only college right now within the Columbia infrastructure that is smoke, vape, and nicotine free. Barnard and COMC are only smoke and vape free. So part of this again is the conversation about which policy we want to go for. What this means is that designated smoking areas won't be within the campus grounds. It will be pushed outside of the campus. Folks would still be able to smoke in places like the mediums, or they can walk along the parks, for example. Those are places that you are allowed to smoke. So it might be encouraging folks to think about where they're smoking and where these designated smoking areas being moved to in that regard. And really, the smoke and vape free section would be within the gates of Columbia. And then also maintaining a certain distance from Columbia buildings outside the gates. And the no retaliation clause that I mentioned on the last page would remain the same, where there would be no retaliation for folks who do smoke or vape. No retaliation in terms of the employers for that regard. The one piece I'll name, I mentioned that we do environmental scans that Taylor and Arthur have been doing. The environmental scans have been really interesting. If you look at the signage across campus, they're pretty varied, if I'm being honest. I imagine some of you on the call are wondering, like, I don't remember ever seeing a designated smoking area sign, and you would be mostly correct because there aren't many across campus. There are those little urns that have like the light blue, like designated smoking area sticker around it. But for the most part, it's the signage is a little hard. In one of the environmental scans, there's a sign. You're welcome to do this if you want to, but there's a sign outside Learner Hall that has a website that says where the designated smoking areas are, and the website's actually no longer active. So even if people went to that URL, and this was the time before QR codes, so it's just the website URL on this placard that you type into Google, but the website no longer exists. So it's also a conversation about updating the signage, making sure people know where they can and can't smoke. Also, the signs that have been changed. There used to be no smoking signs on the lawns, and now they're no longer there. So, what does it look like for us to bring those back, especially when that becomes a fire hazard if people are smoking cigarettes around the grass and the greenery? And then also, like I mentioned, around the different schools, there's no smoking signs and stuff like that that the schools have kind of taken into their own hands. And what does it look like to help those schools be able to advocate and have some of those signage? Um, I'm gonna volley it to Arthur. Arthur, we're talking about the environmental scans. If you have anything you wanted to add, just about what you've noticed about the designated smoking areas, where people seem to be smoking, anything like that.
Yeah, of course. So during our scans, we tend to so I'm responsible for the southern part of campus, and that's mostly what I can speak to. So everything below Uris Library. Basically, there are three or four main spots where people tend to congregate to smoke. One of them is by the gazebo in front of John Jay Hall and Wallach Hall. And another one is in front of Pulitzer Hall by Joe's Coffee, in front of Butler Library, and then on the Low Library steps. So those four spots are where people tend to congregate the most. What I've noticed is that sometimes the congregation in front of Butler can be harmful because it's a central point to traffic on campus, and so students who are trying to get by are often exposed to secondhand smoke, where when they're just trying to either get into the library or follow their path through. One thing that also adds to that is that there are fans from inside the library that put they blow air out, and I'm not sure why it's for. I think it's for weather temperature regulation, but those fans end up propagating the smoke over into the lawns. So when people are on the lawns, that smoke ends up affecting them disproportionately. And in front of Butler is not actually a designated smoking zone, but people will move the designated smoking zone markers and bins to the places where they smoke, which in this case and is most convenient, in quotes, would be in front of Butler Library. The actual designated smoking zone that is closest to that is on the west lawn, so just below those stairs, in front of the library, and people move the bins from one place to another. And even I've even seen facilities do it. So it's an issue just about labeling and understanding where the current smoking zones are, right, and where people are permitted to do that. The other issue as well with the gazebo is that a lot of times, especially when it's raining, students tend to congregate inside the gazebo for shelter from the rain. If they're caught out in the rain, and if there are students smoking in there, you end up being forced to share space with someone who is smoking when you're outdoors, and that can be problematic because you're again being exposed to secondhand smoke without any without a way to leave, except unless you want to go into the rain. What I know from Taylor, who does the environmental scans on the north side of campus and on the other parts as well, is that there are students who tend to congregate by Ween Hall as well as the law school, or spots that people tend to stay in a lot. Now the law school is actually where people congregate is actually outside of campus, so that's not our jurisdiction, but in front of Ween Hall is also a problematic spot because aside from just there being a lot of traffic, there is an outdoor dining hall there, the Fact Shack, and mixing food with secondhand smoke from nicotine is very unhealthy and can lead to unhealthy side effects. So that is prejudicial for all the people that are consuming the food that's being distributed at the Fact Shack. We've also heard student concerns about where these places are positioned, and we've noticed students rerouting when there are large congregations of smokers, like faculty, students, staff, any smokers in general. We have seen that the passersby tend to reroute. So those are just some of the things that we have empirically observed and gathered data from over the last few months.
Thank you, Arthur, for sharing that. And of course, it changes as the seasons do as well. We see less folks outside in the winter versus the summer. We also see an influx. I will name this the other side because it gets colder. We see an influx of students wanting to quit. So there is kind of this tandem where, as we're doing the environmental scans, as there are less folks outside or less folks in these spaces, there actually might be an uptick in the nicotine cessation program for that reason. I will also name we're very strengths-based in the work that we do. I will also name that, as Arthur's mentioning, right, people are moving the designated smoking errands or they're kind of making their own areas. There is still kind of this level of conscientiousness when we talk with students who smoke around like the conscientiousness of who they're around. So that's something that's still there. And while the placement of the areas right now are not necessarily conducive for those who might not want to be exposed to secondhand smoke, or even if it's something where they're trying to access a building, there is still some conscientiousness for that around those for those who do smoke. So I do want to acknowledge that because that's part of the conversation about what does this look like for us, and if we're limiting secondhand smoke exposure, especially on campus, what does that look like, and where can folks go if they do want to smoke? Um, Part of this, right, is that we've been gathering feedback about the proposed policies. And recently we formed a task force comprising of students, staff, and faculty. And it's a pretty wide variety of folks who, oh, thank you. Alex just put in the page for the Nicotine Awareness and Help initiative. So you can look through all the information there as well. The task force comprises of students, staff, and faculty. It's all of us on the call, plus a couple other folks who are able to give us their input. We have student representatives who are graduate students and undergraduate students. Some come from the student councils, some come from the university senate, the student affairs committee. Other folks in the faculty lens come from folks whose background is within tobacco or nicotine research. So we try to have the representation across all three areas because these are three areas that are going to be impacted by a policy change like this. We've been getting feedback from staff and faculty as well. That's mostly been myself. I try not to have the students interact with staff and faculty, try to make it peer to peer, like we mentioned at the beginning. Um, but staff and faculty, we've been getting feedback from as well, and we're involved with the human resources side of things to get some understanding of what from the HR lens, what would be the conversation about the policy change. We do have a survey for students. It's on the page that Alec just shared. And we have a survey for staff and faculty. If students fill out the survey, they get this nice little hydro flask. You might have seen me drinking water throughout this. But this is our not branded hydro flask. Oh, Arthur has his too. The And if you fill out the survey, you can enter a drawing into it. And the survey is meant to be that feedback component of, okay, what should the policy be? What's your current knowledge about the policy, et cetera. So it's meant to be kind of a more like low barrier way to get student feedback. Um, so please feel free to fill out that survey. We also had focus groups that were conducted by our project coordinators last semester. We invited folks and it was we made the events and had folks come, and it was meant to be kind of this, again, peer-to-peer conversation about what our thoughts around the policy change. And we had undergraduate focus groups, graduate focus groups, et cetera. And then we also formed key informant interviews. So we interviewed different offices and campus partners around the conversation of a smoke and vape free campus with the intention of getting an understanding of what the implications are of this changes, right? We're only one unit within, or one department within Columbia University, but there's other departments that might be impacted by this, such as facilities or environmental health and safety, or even university life, for example, and stuff like that. So part of this key informant interview process was meant to really get the feedback from those folks around what their thoughts were about the policy change. Um, and truthfully, we've gotten a variety of different feedback, a variety of different perspectives, I should say. There has been a larger interest in the smoke and vape free campus portion once students learn about the precedents that's been set by Barnard and CUIMC. And for additional context, there's the number has really grown of colleges and universities across the country that are smoke and vape free, especially within the last decade. The Truth Initiative does this grant every year, and there's always about 10 to 12 schools that have come in, or schools do it on their own. I think last I checked, it was a couple thousand different schools and universities that have become smoke and vape free. So we're trying to become a part of that movement. It's also a part of that public health movement, right? Of being able to encourage not just smoke and vape free, so there's less exposure to secondhand smoke, but also reducing health outcomes in the long run for those who either do smoke or might be exposed to secondhand smoke or vapor, which we'll talk about in the next couple slides. Um, I'm going to give some information about the feedback we've been getting. I'm going to volley it to Arthur. Arthur, if you could talk a little bit about what we've been getting at the tabling events and the focus groups, and then I'll finish off with the key informant interview feedback.
Yeah, so we've heard a lot of diverse perspectives from all different types of stakeholders. We have people who smoke, people who don't smoke, people who used to smoke, faculty, students, staff, Columbia like facilities, and just a bunch of different stakeholders. And basically, there are a few trends that keep coming up, either at our tabling events or our focus groups. One is that most students right now tend to think that policy needs some type of reworking, or at least they are unaware of what the current policy looks like, and they need to they would like to be aware so that they're not breaking policy or violating anything because they are unaware. Um, Also, some people disagree with the idea of having designated smoking areas because they think that that could cause either discomfort for the smokers having to like go out of their way is something that we've heard. We've also heard the opposite, saying like, "Oh, you're like causing harm to everyone else on campus because there are designated smoking areas." But some of the also like main points that people have touched on are on how we would enforce this type of policy, right? Like, what are the mechanisms of enforcement, and how do you make sure if you do decide to transition to a nicotine-free or smoking-free campus, how do you do that, right? How do you enforce that? And the mechanisms that people have brought up in general have all been around positive enforcement and about learning and education instead of focusing on punitive resources. So instead of creating mechanisms for policing or for members of the community to expose other members of the community. The whole point is to make treatment available for those who want to quit, and also have resources available for cessation in general, but make it positive, make the enforcement positive. So instead of, for instance, having someone tell you, hey, like you're not allowed to smoke here, and if you do, you are going to get sanctioned from the university. It could be something like, hey, you're not allowed to smoke here. This is a new policy we have. This is a warning in case you commit something like this again, an infraction like this again, you'll be redirected to basics, right? Which is a project that Rocco runs under Columbia Health, and they do some education around nicotine cessation and some other things, but it's just like an initial program, right? Some concerns that have been brought up are smoking indoors as well, which then become two violations because not only are you violating Columbia's policy, you're also violating federal law, right? And in that case, it is the enforcement mechanisms would have to be slightly different, and we've gotten feedback on how we work with those. But overall, the feedback has been that people do believe that we need more clarification and some sort of change to our policy. There are people who are in favor of moving and transitioning to a smoke-free campus. And there are stakeholders who think that the current policy that we have makes some sense as long as we can expand it or shift it a little bit to incorporate the new realities of our campus and the forms of access to campus that are currently in place, and as long as we're also acknowledging and being mindful of the enforcement mechanisms.
Thank you, Arthur. Yeah, and as Arthur named, like it's a myriad of different responses, and we're looking at enforcement and really wanting student feedback around what the enforcement should look like, especially when it comes to compliance, because we do have at least an ethical responsibility to make sure students aren't negatively impacted by this, whether it is folks who do currently smoke or even folks who don't want to be exposed to secondhand smoke. We do have an ethical responsibility to make sure those folks aren't exposed to those environmental concerns. The other interesting things I'll name, this even happened today at the tabling event I went to, but we had students name different experiences where they have been exposed to secondhand smoke or vapor. I had a conversation with a student today about how she likes to eat outside and eat lunch, but it's very different when she gets to eat in these little courtyards with somebody smoking. And what does it mean to be exposed, especially if you're trying to just kind of go about your day? We also had conversations with students about like I mentioned, interacting with sorry, I got a phone call as that was happening. Interacting with folks as they're entering buildings. We talk a lot about the libraries. I know Arthur, in one of your environmental scans, we talked about a specific room in the library that people typically vape, but people might not be conscious of the impact and the damages that might come to the books in the room, and stuff like that. So we think about those different lenses as well. In the key informant interviews, we had some really interesting feedback from the different places on campus. Facilities and operations was our first one. They were really excited for this, but we actually got some interesting feedback about the impacts of the campus like setup in relation to secondhand smoke, because since COVID, right, they've had to update the filters in the schools that filter air. And they're actually finding that because people are smoking on campus, when people smoke on campus and they go buy these filters that is pulling in clean air, like there's secondhand smoke going into the buildings more readily now. So that was something they named in this key informant interview that we didn't even know was there. I didn't even know they got new filters. And it was something that was really helpful for us to have some sort of context about the ways that people are being exposed to secondhand smoke now, especially since not only has it been 10 years and we've had the introduction of vapes, but we also had a pandemic and a quarantine. In some ways, we're still in that. So like it's thinking about through those different lenses of What does the exposure look like now? How is it different? And what changes things? We've also gotten feedback from different places like the University Senate. Alec and I went to go speak to the Student Affairs Committee, which is truthfully where we got the feedback about being in the communities more, right? We also talked with the libraries, got some feedback there, especially Butler Library, where we're seeing a lot of folks smoke outside. What are the implications of that if somebody is outside something like a library? And what are the, like I said, implications on the books and the special collections that we named and things like that? And things that are really like, I would say like also valued at the university. So what does it look like? And we're a lot about values in the work that we do. So what does it look like for us to be able to still have an alignment of values when it comes to the policy that we're implementing on campus? One that we're still able to let folks, if they do decide to smoke, be able to still do so in a way that's still safer than what might be currently happening. So that's really the feedback that we've been getting. For the most part, folks are for it. Any sort of critiques we've been getting have usually been around a couple different things of the idea of the change and like folks who don't necessarily believe in the enforceability of the policy. One of the common critiques we get is, well, people are just going to smoke anywhere. So our hope is to really do that education campaign and talk about positive reinforcement, as Arthur mentioned, as well as doing a lot of information heavy work around letting folks know what are the implications of this change. So the that's one of the comments we've been getting. As well as concerns about where folks are going to be smoking if this policy changes. What does it mean that they're just going to move to the gates and stuff like that? And part of that is encouraging the policy around the distance from buildings as well, and really renaming kind of those like pros and cons to a smoke and vape free campus. The In terms of the timeline for the policy proposal, so as we mentioned, we really started this work in spring of 2024. Is when we actually started a lot of the grant projects. Is when I hired Arthur and Taylor. And we spent much of the spring and the summer doing some of that preparation work on the back end. So we came up with a cessation plan. Like we needed to really kind of streamline what is our cessation resources on campus and what resources do staff and faculty have for cessation and the educational tools that we had for folks who are quitting and things like that. And then in the fall, we really started gathering feedback. We had actually had another town hall in October that went really well. And then we were doing the focus groups and the key informant interviews at that time, as well as tapping folks for the task force. That was really helpful. So we had folks who were in this kind of getting the awareness out there about this policy change, as well as getting feedback about what they want the policy to be. And then this semester, where we're continuing to gather feedback and we're starting to write the policy, we're also doing a number of events. Last semester, we actually did a dog therapy event. It was like "Love Your Pets, Love Your Lungs." No, "Love Your Lungs, Love Your Pets" was the title. But it was about the exposure of secondhand smoke and how it impacts not just your mental health, but also your physical health, the physical health of your pets. Because that's something that's a common reason that people may quit or people may not even realize that it is impacted. So we did that last semester, and then this semester we're going to be doing two events. Later this month, Arthur and I will be doing a lunch and learn. It's going to be a virtual brown bag for context around big tobacco and the nicotine industry. If you know anything about the history of the tobacco industry and the nicotine industry, there's been a lot of misinformation and disinformation around nicotine that's intentional. So folks do have this misunderstanding of what the impacts of nicotine are. And if you know anything about the tobacco playbook, which is the actual term for this disinformation campaign, it's actually been used by other lobbyists, like it's been used for climate change denial and stuff like that. So we're going to be talking about what is this master settler agreement that happened in the 90s that really emphasized folks have to be truthful about nicotine use, as well as what are the different implications and groups that have been targeted by nicotine advertising and the disinformation that's occurred. So hopefully doing a little bit of myth dispelling in that. So that'll be later this month. Be sure to look out for the date and information on the website. And then in April, we're going to be doing an environmental event centered around the effects of nicotine in the environment. So that'll be all this semester. And then either at the end of the semester or the summer or the fall, we'll be doing a policy proposal to the University Senate. We're going to kind of work with the university on this one to see when the best time is to submit this policy proposal. But we'll at least have the policy written by the end of the semester that we can at least propose to the University Senate. And then once it's up there, it's up to the powers that be. The University Senate is the one that has to vote for it to decide if it becomes a policy on the Morningside and Haddonville campus. I mentioned this already, but I do want to talk about the benefits and considerations of a smoke and vape free campus. This is really intentional because sometimes folks may not understand or even have the full knowledge around like what does it mean to be smoke and vape free and what are the long-term implications, right? So it's not just about limiting exposure to secondhand smoke and making sure there's kind of a streamlined understanding of what the policies are, but it's also meant to be an opportunity to educate the community and members on nicotine and tobacco. We know with the rise of vaping, there's a lot of question marks around is vaping safer? What does it look like for us if you're switching from cigarettes to vapes? What are the implications of this, et cetera? And we're seeing a lot of research that ends up being really similar to the effects of cigarettes. So really about having folks understand like what is nicotine? How does it impact your mental health? How does it impact the environment? How does it impact all these different layers? And really doing that education campaign that we mentioned to help folks understand the effects of nicotine. We also find that there's economic and environmental benefits. There is overall, if you look at what is it, Healthy People 2030, it's a public health plan that is national that's aimed at helping reduce nicotine rates, right? As well as there's economic and environmental benefits. When we talk to facilities and operations, they mention there is an economic benefit to going smoke and vape free, not only because it saves time for them when they're cleaning up cigarette butts and vapes and stuff like that, because now they'll know that there's specific places they can go. But it also makes it easier for them so they're not spending as much money. Because they mentioned there's certain times where folks are on, say, like gravel or stone or things like that. It's harder to pick up the butts and stuff like that. And it might take a little bit more time, just time and energy, right? So there's a cost benefit to making this change. We also see reduced rates of tobacco and nicotine use on campus. So again, as the tobacco cessation specialist, I do want to emphasize that smoke and vape free campus actually helps folks who do want to quit because it makes the process a little bit easier. Because if you're somebody who's quitting and you get a craving, it might be harder. It might be easier to say, no, I'm not going to do this because it means they have to leave campus to go smoke or vape. So part of that is really meant to reduce the nicotine rates on campus for folks who are quitting. And there are conversations, and Arthur mentioned that we've talked to students who used to smoke, who have quit, who said they would be for it, not just because it's meant to be something to help encourage other folks to quit if they want to, but also because it helps prevent relapse and prevent folks from smoking again from the exposure, because they know when they go to campus, it's meant to be this place where it is smoke and vape free. It actually lines up with one of the strategies that we talk about in nicotine cessation. One of the strategies is what does it look like for you to go to places that are smoke and vape free? And sometimes those look like museums or cafes or even workplaces that are smoke and vape free. So part of it then becomes, okay, the campus is now a smoke and vape free place for you. So now it's a safer place for you to go to practice your quit strategies and be in a place where you know there's going to be less exposure to nicotine. And part of that, like we mentioned, includes secondhand smoke and vapor exposure on campus. Part of that is meant to be limited and mirror the other policies at other institutions and campuses. Harvard, UPenn, and NYU, for example, also have all smoke and vape free campuses, as does CUNY. So there's different universities, even within New York City, that already are kind of within the city structure that have also been able to implement a policy like this. And then there are a couple considerations we have as well. Exceptions to the rule, like we'll write in, of course, includes nicotine for research and the use of sacred tobacco being used by indigenous populations for ceremony. College Walk, we are mindful that College Walk is a walkthrough for many non-Columbia affiliates. Non-Columbia affiliates being folks not a part of Columbia. So we know that there's technically a public walkway. So part of it is going to be an understanding, and we have done outreach to the local folks to get their feedback as well, just around like, okay, if you are walking through campus, what does it mean for folks who are smoking vape free now who wouldn't be walking through campus to smoke otherwise? And then, as we mentioned, enforcement, really being mindful about the education and resource focus. We don't really want to emphasize a punitive approach. We know that doesn't work. So we really want to emphasize having that education, intervention, and resource focus of enforcement, so folks do understand what the policy is, as well as get support if they are looking for it. So these are the resources we wanted to name. We have the Truth Initiative, as we mentioned, as well as New York City Quits and New York Smoke Free. Both are great resources to either get free nicotine replacement therapy, which is other patches, lozenges, and gums, or just other information about quitting in New York City. And then there are Columbia-specific resources for students. There's a nicotine cessation program. Staff and faculty have resources for quitting smoking within the health insurance and Columbia EAP program. And the non-Columbia affiliates can call NUSC Quits or dial 311. Truth Initiative also has a number of information about like what does it mean to go smoke and vape free, educational, health literacy around health education around nicotine, as does Go Ask Alice. So highlighting those resources as well. So at that is the end of what we have. But we have about 10 minutes left. We do want to turn it over for folks if there are any questions in the audience. This is your opportunity to ask folks who are leading the project, like if you have any concerns, questions, anything like that, that you want to name. And again, feel free to use the Q&A function. If there isn't one, you can also chat the panelists directly.
We do
Also,
have,
I want to take the
oh,
opportunity. Oh,
go
sorry.
ahead, Arthur.
I just take the opportunity to say that we will also be fielding unrecorded questions at the end, right, Rocco?
Yeah.
Yes. So in case you also do not want your question recorded, just wait a little bit, and then if we have any recorded questions, we'll take those, then we'll field unrecorded questions at the end.
Yeah.
Okay, one question that has come in. If we become smoke vape free, where will people go?
Yeah,
Just
that's a good question. It is a concern that has come up when we're talking to students who currently smoke or vape, because you're also navigating New York State and New York City law at that moment. The um, the one thing that is people can go to are the mediums, right? So the mediums within the street, like if they cross the street where the benches are, that's typically places that people go smoke, and you might even notice like non-Columbia affiliate smoking there. That's a place that's legal within New York City to smoke, as well as along the sidewalks along parks. So those are places that students can go. We're luckily and fortunate that we have two parks on either side of the campus, so folks can either go through the sidewalks there or go to the mediums, and that's where people can smoke. Again, the intention is not necessarily to, um, the intention is right to have spaces where people can go smoke if they want to, but also limiting secondhand exposure on campus. And if you're students, it's also meant to encourage folks who might be considering quitting to quit because there's all these health benefits when you do quit. Nicotine is one of the number one precursors for long-term health effects, especially negative health effects. It's one of the number one predeterminants of that. So by encouraging folks to quit, it's also encouraging health outcomes. And that's kind of the broader public health conversation that's happening there too. Oh, you're muted, Alec.
sorry about that. Another one. Have you all considered how zines might evade typical nicotine vape-free policies?
That's a very good question. And truthfully, we have. Um, Part of the conversation, right, is smoke and vape free. Zins are truthfully harder for us to monitor. It's harder for us to, we're not asking people to opening their mouths, right, and stuff like that. So they're easier to evade. And smokeless, right, if somebody's using a smokeless nicotine, they're not necessarily exposing somebody to secondhand smoke or vapor, right? So there's not really from the public health perspective, it's more about the individual's health at that moment, but they're not necessarily exposing people to secondhand smoke, which could cause also somebody to have reactions. The so we have thought about that for sure. One of the ways that I mentioned TC is nicotine free. One of the ways they've explored it is making it that you can't throw out Zins within public trash. Technically, nicotine again is still a hazardous waste. So what is it for us to have ways for folks to dispose of Zin, in that regard? So that's one of the things we're navigating. If I'm being really truthful, when we're talking to students about the policy change, there seems to be a lot more conversation about smoke and vape free, but nicotine free seems to be kind of the edge where students are a little bit less for it, because then it feels harder to monitor and enforce and stuff like that. So that seems to be a line we're still navigating, and we're still taking feedback for that from the survey that we put in. So if anyone wants to fill that out. But that's one of the considerations we have. So if the policy goes the direction of smoke and vape free, it doesn't necessarily mean that Zins are going to be um, removed, but it might be that they can't throw it out in certain ways. I have also thought about it from the treatment perspective about how people might turn to Zyn as a way to limit smoking and vaping. In that regard, though, we're still thinking about reducing the secondhand smoke exposure, and it can still be something that comes up when folks are making that change. The hope, though, is that as we're making this policy change, we're really encouraging folks to opt towards, if they do want to quit smoking, going for something that's quit smoking medication versus Zins. 'Cause that's a common conversation I have because Zin isn't necessarily meant to be for quit smoking. So it's a little bit of a complex response, but we're definitely keeping that in mind as we're going through the policy.
And I am not seeing any additional questions right now in the chat.
Cool. Um, in that vein, like we mentioned, we're planning on at least writing the policy this semester. If folks do have any other questions, you are welcome to reach out to help@columbia.edu. That is the point of contact for this program. We're taking feedback that way. If you have any questions, truthfully, I'm the person that's responding to them. So you will hear from me if you send a message. But that about wraps up our town hall. If folks do have any questions, we are going to stick around. And I think that we will stop the recording just so if folks do want to ask any questions, without the recording, they are welcome to. Um, so, um,